Good evening and welcome to Chicago Tonight. I'm Paris Schutz.
And I'm Brandis Friedman. On the show tonight,
we will meet that deadline.
How Vice President Kamala Harris spent her day in Chicago as the city agrees to meet the White House's plan for COVID vaccine eligibility.
Plus, what the latest COVID surge means for expanding the vaccine rollout in Chicago and Illinois.
Our focus is on engaging with Democrats and Republicans.
Is a bipartisan infrastructure plan likely to happen? Local members of Congress weigh in.
After a dramatic fall in ridership caused by the pandemic, we discussed the future for local public transit.
We want to make sure that we get something that this community is going to be proud of.
As a 2-decade overhaul of the Michael Reese site moves forward, how developers and designers are working to create community connections.
Chicago has a contract with a new recycling company, and advocates say they're cautiously optimistic.
It's very natural for us. These are flavors that we grew up with.
And a Chicago bakery braids Mexican flavors into traditional Jewish pastries. But first, some of today's top stories. Chicago police are investigating how a 21-month-old boy was shot and injured in an apparent road rage incident on Lakeshore Drive this morning near Grant Park. The child has been transported to Lurie Children's Hospital, and police say a firearm was recovered. Police also say a second vehicle involved fled the scene. Mayor Lori Lightfoot reacted during a press conference this afternoon.
It's clearly tragic. I'll just leave it at that. It's mind-boggling to me that people carry guns in the way that they do, that they use them in the way that they do, and they use them in that way when children are in immediate proximity.
The child remains in critical condition, and there's more information on this story on our website. Coming up in a moment, Amanda Vinicky has more on the White House's reaction to Chicago's increase in violent crime and the mayor on the vaccine rollout. Nearly 3,000 new cases of the COVID virus have been diagnosed since yesterday, and an additional 13 people have died. The state's total case count is over 1,261,000, and 21,395 people have died. Just over 19% of the population has been vaccinated. And as cases rise nationwide, the Chicago Department of Public Health has added 4 states and the District of Columbia to the orange tier on its travel map. That means travelers from those and 20 other states must quarantine upon arrival or test negative for the coronavirus before coming into the city, or those folks must be fully vaccinated. Now, that's defined as 2 weeks after the final dose of a COVID vaccine. 6 states have been shifted to the yellow tier, joining 19 other states and Puerto Rico, for which no quarantine or negative test is required. A number of Minneapolis police officers, many of them members of the department's training team, testified today about former officer Derek Chauvin's placement of his knee on George Floyd's neck for more than 9 minutes by the prosecutor's count.
Would it be appropriate and within training to hold a subject in that prone restrained position with a knee on the neck and a knee on the back for an extended period of time after the subject has stopped offering any resistance?
No, sir.
Or has lost their pulse?
No, sir.
Now, that witness you just heard from was Lieutenant Johnny Merciel. He testified that Chauvin took a 40-hour course in 2016 on how to recognize people in crisis and how to use de-escalation techniques to calm them down. Chauvin's attorneys, though, argued that he was doing what he had been trained to do and pointed to moments in the video where Chauvin's knee appears not to be on Floyd's neck. Since the coronavirus vaccine debuted in December, Chicago and suburban public health departments have limited who is and who is not eligible for it. Now, that's set to change. This news comes on the heels of a high-profile visit from the U.S. Vice President and the promises of help from the feds. Amanda Vinicky joins us now with more COVID vaccine news. Amanda.
Yeah, Brandis, those rolling vaccinations limited eligibility first to healthcare workers, then to seniors and so on. Now all essential workers in Chicago are included and are eligible. The city wasn't set, however, to give every adult a shot until sometime in May. That is changing. President Joe Biden today, the nation is moving up the timeline for all adults to be eligible for a COVID vaccine from May 1st to April 19th. Mayor Lori Lightfoot says the city's ready to meet that deadline.
We will meet that deadline. We need more vaccine from the federal government, but we're optimistic based upon conversations that opportunity will happen.
Chicago had previously been reticent to do so. The mayor says she didn't want to create an expectation and not be able to meet it, given that demand for the vaccine still outpaces the supply. She also says it was a matter of logistics. But after talks today with Vice President Kamala Harris, during their visit about the feds guaranteeing more doses coming to the city of Chicago, the mayor says that April 19th is going to be the target date. Chicago's public health director, Dr. Allison Arwady, says that actually changing the eligibility guidelines early had been something the city was already considering.
Partly because we have been seeing cases being driven so much by that 18 to 29-year-old age group in Chicago, and thinking about, wanting to follow where that data is and push vaccine where it's most needed. The only hesitation has just been vaccine supply, and we are not seeing the huge increases, partly because of the Johnson & Johnson issues with manufacturing.
Already, the mayor, Governor J.B. Pritzker, each had a chance to talk about all of this with Vice President Harris during her stop in Chicago. The vice president toured Chicago's Union vaccination site. This is a labor-run vaccine clinic for members of labor unions. Harris called it a model for the country and said that it is a place where the dignity of work is recognized. The mayor says it was a place where the vice president was able to see Chicago's commitment to equity and to diversity on display.
Other reason that the vice president came, and what the interest has been at the federal level, is this equity focus. As the mayor said, really having a focus on getting the majority of our first doses to Black and Latinx Chicagoans every week. It's not typical across the country.
Arwady and the mayor say that they are proud of Chicago's efforts to get vaccines to the city's most vulnerable for COVID areas, and that is often pockets of the city where the majority of residents are Black and brown. But Alderman Byron Sigcho Lopez is among the critics who say that Chicago is failing from an equity perspective, and he's really bitter at the mayor over that, including for using federal coronavirus relief funds and sending them to the police.
Our communities are desperate, they're suffering, and they have been suffering from disinvestment in a time where we can have put those $281 million back into our communities for relief, for vaccination, and other important services that are needed.
Lopez says that is information that Vice President Harris should be aware of, and he tried to get her attention. He was among those protesting this afternoon outside, and even, I believe, for a bit inside a press conference. They were shouting anti-Lightfoot chants. You can actually hear some of a drum circle as Senator Dick Durbin speaks.
This is a critical moment in this pandemic. People are tired of it. I'm tired of it. But we can't break the back of this pandemic unless we push for more vaccinations.
Now, the vice president wasn't, as of today, or ever really planning to be in attendance at that press conference, but the mayor and the governor both were. And then instead, due to some sort of apparent mix-up or miscommunication, neither ended up showing. Now, the governor's team says that he was unable to reschedule due to having other activities this afternoon, but the mayor did instead hold a later press conference at City Hall. She says that was not done to avoid protesters. She says, nor was it to avoid having to stand near Pritzker, despite a divide between them.
It has nothing to do with that. I mean, the governor and I may not agree on every policy issue, but he and I have worked very, very hard over the time that I've become mayor to make sure that we have a very good working relationship, and we do. The simple matter is I had to pull aside with the vice president, and the press conference started without me.
Now, as Harris was arriving in Chicago, as you just heard a bit ago, a baby was shot on Lakeshore Drive. Reporters at the White House today asked Biden's press secretary about that, and she said that the president is committed to gun safety measures.
We work with communities to invest in community violence prevention. He's actually proposed funding to do exactly that, something that many groups support because they believe in order to reduce violence, in order to address the prevalence of violence in communities like some in Chicago, that we need to spend the money from the federal government to do exactly that.
Asked about it, Congressman Danny Davis says that he favors mandatory background checks. He favors a ban on automatic weapons, and then he even suggested going further.
Stopped making them, then I would be in favor of not making handguns that individuals use to hunt other people with. And so it's a big issue. It's a big problem. It requires serious attention, and that's what's being done right now.
Now, as for the COVID vaccine, Vice President Harris this afternoon tweeting, Illinois, we said help is on the way, and now help is here to get more shots in arms. Some $123 million coming from the CDC to both the city and the state that is to be used on vaccine outreach and access efforts. Harris's business, by the way, not all total business. She had time to get a little bit of sweet in, stopping by Brown Sugar Bakery on the south side. She picked up cupcakes she said were going to be given to staff. Sorry, I wasn't there, so no brown sugar deliciousness for me or for you, Brandis.
Darn, anybody who's been there knows it's a place to go. Thanks, Amanda.
No problem.
And we'll have more about vaccine equity later in the program. But now to Paris with some members of Illinois' congressional delegation. Paris.
Brandis, the White House and Democrats are out pushing for President Joe Biden's American Jobs Plan, but Republicans are pushing back, saying the proposal is light on infrastructure and heavy on items from Democratic wish lists. And joining us now to talk about that and much more are Congressman Mike Quigley, a Democrat from Chicago, Congressman Raja Krishnamurthy, a Democrat from Schaumburg, and Congressman Rodney Davis, a Republican from Taylorville. Welcome all of you back to Chicago tonight. Congressman Davis, I want to start with you on this infrastructure bill. You've said on this program in the past you've met with the president and the vice president on infrastructure, but you disagree with the approach that House Democrats and Speaker of the House Nancy Pelosi is taking here. Are Republicans at the table on this at all?
Well, Republicans have been at the table. We're more than willing to talk about negotiations when it comes to true infrastructure investment. As you mentioned, I was at a meeting with President Biden, Vice President Harris, Secretary Buttigieg just a few weeks ago. We implored the administration to do not use the reconciliation process and make this partisan. And it seems to me that may not be the administration's approach, but it seems to me they might have been pressured by Leader Schumer and Speaker Pelosi to take a partisan route, which is only going to cost more and give us less infrastructure investment.
And Congressman Quigley, the Senate parliamentarian ruled that the upper chamber can use the reconciliation process on this, even though they already did use the reconciliation process on the COVID bill. Is that the only way you believe that this bill, this infrastructure plan, will pass?
I think if you need it, go ahead and use it. I mean, if the Republicans want to dance, let's go. Let's go big on infrastructure. We're getting outspent 3-1, 4-1, 5-1 by our competitors. We're $3 trillion down. My argument is we can't go small. And if the Republicans don't want to go with a significant package, we'll use any process we have to.
Congressman Krishnamurthy, Congressman Davis talked about the bill being light on infrastructure, supposedly, and there are things that wouldn't be considered traditional infrastructure, like mass transit, roads, and bridges, like $400 billion for home-based care, for example. Why is that considered infrastructure?
Well, I think that right now, especially during the pandemic, we learned that our healthcare infrastructure is not very good, and I think that one of the reasons where we are is that we have to upgrade various aspects of our healthcare infrastructure. But there are all kinds of parts of the infrastructure package that my Republican colleagues hate, such as upgrading the electrical grid so that we can finally move to a renewable energy economy. They don't like the clean drinking water aspect of this infrastructure package so that we can replace lead pipes and allow all children to drink clean water. They also don't like the fact that we have a high-speed internet as part of this infrastructure package. but we've learned the hard way during the pandemic that whether it's telemedicine or e-learning or working from home, all people, whether you live in a rural area or an urban or suburban area, deserve access to high-speed internet. So we welcome the debate, and I look forward to it.
And Congressman Davis, part of the proposal is a hike in the corporate income tax rate from 21 to 28%. And just this afternoon, Amazon founder Jeff Bezos came out in support of hiking the corporate rate. And this comes as, we see dozens of major businesses paying $0 in taxes in 2020, including Nike, FedEx, Dish Network. Should these corporations be paying taxes, especially with government borrowing so much and 2020 being such a difficult year?
I can see why the blue-collar workers finally flipped to voting Republican. It's because my colleagues on the other side of the aisle want to continue to put them and the companies they work for at a competitive disadvantage. We had historic economic growth because we made our tax code more globally competitive, and we were able to bring jobs back to America instead of seeing American companies ship them overseas and still pay no taxes. Now, if my friends want to talk about infrastructure investment, I'm more than willing to do that. I've got a record of bipartisan infrastructure packages that have gone through the committee that I serve on. But in the end, spending $50 billion to stand up another agency within the Department of Commerce and only spending $42 billion on upgrading our locks, dams, waterways, ports, and airports, that's not infrastructure. That's growing government. We all want broadband expansion. We want to make sure that money goes to actually get to the last mile. But in the end, a proposal that spends more on electronic vehicle charging stations than it does on rural broadband expansion is not what my constituents want.
Congressman, quickly, it's not just Republicans that have come out not so hot for that corporate tax expansion, but also Senator Joe Manchin, a conservative Democrat from West Virginia. Is there going to have to be negotiation on that rate?
Hey, negotiations are fair game. But the fact of the matter is, under this proposal, the vast majority of Americans, clearly the blue-collar Americans that Rodney was talking about, aren't going to have any change. In large part, this is paid for by repealing what was, I would argue, a disastrous tax plan in 2017, which did very little to grow the economy and actually increased our debt about $1.5 trillion over a 10-year period.
Let's hear from President Biden's press secretary, Jen Psaki. She said he's hoping that the infrastructure plan can pass on a bipartisan basis. Take a look.
Less than a week after he announced the American Jobs Plan, our focus is on engaging with Democrats and Republicans, with staff, with committee staff, inviting members to the White House next week, and we are encouraged by some of the statements that have been made about components of the package.
Encouraged by some statements, but it still doesn't look like bipartisan buy-in at this point. Congressman Krishnamurthy, are there any other points of negotiation and compromise that the two parties can come to on this?
I hope so. And I heard Congressman Davis's bark as he was talking about his position on the issues. And I think he was objecting, just as every cat, dog, and American will be objecting to the Republicans saying no, no, no to an infrastructure plan and using the filibuster to basically prevent us from making progress on this vital area. We are open to negotiations on everything at this point, and I hope that we can negotiate whether it's the package with regard to locks, dams, and dredging our rivers, whether it's upgrading our internet capacity, or whether it's putting electric vehicle charging stations so that we can finally have more electric vehicles on the road and people aren't worried about running out of juice as they're traveling across the state of Illinois. But it can't be a position of just filibustering anything that comes out of the House and preventing real progress, because at the end of the day, if we don't do this, it's not like the Chinese aren't going to upgrade their infrastructure on a continual basis and basically eat our economic lunch.
All right, well, we're going to leave it there for now. We'll be back in just a second. We'll be joined by the Congress members later in the program to discuss safety on Capitol Hill and voting rights. But first, our thanks to Representatives Mike Quigley, Raja Krishnamurthy, and Rodney Davis. Thank you very much. And now to Phil Ponce and the future of local public transit. Phil.
Paris, the coronavirus pandemic and mitigation measures to control it have led to a huge drop in ridership on public transit. Transportation experts say Metro lost as much as 90% of its riders at the peak of the pandemic, while the Chicago Transit Authority saw ridership drop around 70%. So as more people get vaccinated and the economy reopens, are riders going to come back? Joining us to share their insights are Audrey Winink, transportation specialist at the Metropolitan Planning Council, Kate Lowe, associate professor for urban planning and policy at the University of Illinois Chicago, where her research focuses on transportation equity, and Jackie Grimshaw, vice president for government affairs and a transportation specialist at the Center for Neighborhood Technology. And welcome all to Chicago tonight. Audrey Winink, how big a hit have local transit agencies taken as a result of the pandemic?
Ridership is way down, and because revenue comes from transit fares in part, their income is way down as well.
And Jackie Grimshaw, the big question that we're asking tonight is, how do you get riders to come back? Any ideas?
Well, yeah, you have to do a little bit of education and communicating with riders, letting them know that it's safe, emphasizing all of the hygiene provisions that the transit agencies have provided in terms of wipe downs and masks, and providing what do you call it?
Sanitizers?
Sanitizers, that's the word. So that people feel confident, and it's continuing to do the things we've done thus far, masking, distancing, and so forth. And letting people know that the transit agency is doing all it can to make the vehicles and the stations as safe as possible.
Kate Lowe, is anything known, or have there been any studies showing how people are behaving now? Are people social distancing and wearing masks on public transit, or anecdotally or empirically?
So internationally, we haven't seen a high correlation between transit use and COVID cases. A lot of that hinges on adopting safe behaviors and things like masking. I think the federal level has taken appropriate action by mandating masks in transportation. However, we don't have local data on what mask compliance looks like, but hopefully soon with the vaccine rollout, that will become less of an issue in the coming year.
Audrey Winink, one proposal that came from the head of your agency was to lure riders back by temporarily, at least, either lowering fares or allowing riders to ride for free. Thoughts on that?
Yeah, there really could be, with the federal COVID relief that we have seen, that allows a little flexibility for innovation. There could be some type of welcome back program where discounted monthly passes were offered, say for the rest of 2021. And once you have a monthly pass in hand, it feels like it's free every time you take a trip. So getting people their muscle memory back in terms of riding transit, that could be an approach.
Jackie Grimshaw, as we look at that proposal, the lowering fares or dropping altogether, good idea from an equity standpoint?
Well, when we look at the riders that continue to provide those seat rides on transit during the pandemic, that 40%, 30% that continued to ride, these were essential workers. And usually the essential workers are the ones that are lower income. And particularly when you look at some of the jobs of those essential workers, they are mostly Black and brown. So if we look at from an equity position, having the opportunity to have, as Audrey said, that I call it an HMO pass in your pocket. With an HMO, you go to the doctor, you don't have to worry about the bill because it's already paid for. The same thing with that monthly pass in your pocket, that you start to use it. And if it's more affordable, then of course more people will use it.
Kate Lowe, looking at the system big picture, what are the other equity issues that need to be addressed, as the expectation is anyway that riders will be coming back certainly at some level?
So I think we have to think about what's going to happen after the pandemic in context of what's been going on for the last decade. We've seen a 26% drop in transit ridership on buses between 2008 and 2019. So what's going on with bus service and ridership jobs? So I would argue improving service quality on bus lines is a really critical equity issue and also critical for the health of the system. We need to provide fast, reliable service, and part of that is improving bus service.
Audrey Wennick, are there any particular projects that would promote equity? There's talk of extending the red line, fixing up the blue line. Your thoughts?
Yeah, the red line extension is probably the big one that would provide CTA service on the south side of Chicago, where there is no CTA service right now. And I think another way to think about transit is operations. So making sure that we are operating transit more midday service, possibly later into the evenings, which would help workers who don't have a traditional 9-to-5 job, the service workers, that would help them.
Jackie Grimshaw, one of the things Mayor Lightfoot has mentioned as far as encouraging people to go back to public transit is to charge a congestion fee for people who drive downtown. What are your thoughts on that?
Well, congestion fees have worked in other cities across the country and across the world, and it's been studied here. And the challenge for us is actually how you implement it. And I know there have been a lot of suggestions, proposals how to do it, but it's not something that can happen very quickly. And if we're going to have our economy come back, I think we need to take some measures that are more easily implementable than trying to go to congestion pricing.
Kate Lowe, there's a report this afternoon that Metra is adding trains on 3 different lines. Is that an indication that maybe things are already at least inching their way back to normalcy?
Well, having high levels of service and frequency is critical to get the ridership back. So we have to invest to see the ridership impacts that we hope for our transit system. So it's a promising step, but there's not going to be immediate rebound. It will be a recovery across sectors, including transit.
Audrey Wennick, there's a concern among people in public transit that with all the people working from home, that it's never going to go back to the way it was. In that, employers are going to start letting their employees work maybe 1 or 2 days from home going forward. When do you think it's possible for ridership to get back to pre-pandemic levels?
It's going to take a while. It's going to take a couple years to see what the real outcomes are going to be. And I think we're probably going to see some different distributions of when people are traveling. So we're going to want to offer more service during the midday, possibly. Metro is a huge asset, possibly looking at turning that service into more of an all-day service, regional rail that's going both directions. So we're going to need to adapt our service as we see the needs adapting and, make it work for the society that we're going to be living in post-COVID.
Couple of years. Audrey Wennick, thank you for your observations. Jackie Grimshaw, likewise, and Kate Lowe, thank you as well. And up next, an update on the redevelopment of a long vacant site on the city's south side, so please stay with us.
After more than a decade of sitting unused, the former Michael Reese Hospital site in Southside Bronzeville appears headed for redevelopment. Earlier this year, the Chicago Plan Commission approved a $3.8 billion effort to overhaul the property just west of the lakefront on 31st Street. As Chicago Tonight's Nick Blumberg reports, the team behind the development is thinking big and working for community buy-in.
Michael Reese Hospital was one of Chicago's oldest, founded in 1881 and demolished in 2009.
There's been a number of iterations of should this be the Olympics, should this be Amazon HQ2?
The city bought the 50-acre property as it was preparing for its failed 2016 Olympics bid. In 2017, it picked a team of developers to take over the site and create a master plan for a massive mixed-use development.
We knew the potential of this site and what it really could mean for the entire South Side and the people who are most vulnerable in our city who need it most.
The project's first phase is set to include the ARC Innovation Center, an equity-focused research arm of Israel's renowned Sheba Medical Center. ARC's mission is to make healthcare accessible, and the designers of the Bronzeville lakefront site say this building will reflect that.
It frames a literal gateway into the development, but it also frames a gateway towards the Singer Pavilion, which is a historic building that we're choosing to preserve and keep on the site.
Beyond keeping that building, urban designers and architects are working to reimagine just about every facet of the massive site.
Everything from the roads to the parks to the blocks to the uses, what the place should look and feel like, and then how it should connect back to the surrounding community.
And the developers and designers working on the project say the community has played an integral role. It's not a one-and-done town hall meeting. 4th Ward Alderman Sophia King put together a Michael Reese Advisory Council to weigh in every step of the way.
For many of us who live on the South Side, this is long overdue. I think the development team is taking very seriously what they're contributing to the neighborhood. Once this is done, I think we'll set a new standard for development on the South Side.
Urban designer David Scully is a Southside native and graduate of IIT, a mile away from the site. He says true community engagement is a way not just to win support, but to create something that feels like it's part of Bronzeville.
You always want to be working with community to actually create something that's more than the sum of the parts. It's not just a new building here and a new park here, that those actually have tangible meaning for the neighborhood.
In addition to the ARC Innovation Center, the site's also slated to have market rate and affordable housing, including for seniors, retail with discounted rent for some local businesses, green space, and a community center.
The folks here in the community need to feel like it is part of Bronzeville. It's not a separate district. It's not, a gated community. And that connection brings me joy personally.
Farpoint's Morgan Malone says she hopes the community-centric approach can be a model beyond this one project.
Where it may seem hard, it may seem too complex, when you put people first, you can win, you can do it, it can be financed, it can be possible, and everyone will benefit. And so we're excited to prove it.
The redevelopment of the full site is expected to be a 2-decade effort, but the Advisory Council's Kimshasa Baldwin says if you haven't spent much time in the area, you don't have to wait.
Come on down. Come hang out. Come on down. Bronzeville, it has spirit, it has soul, approachable soul, I should say. It's not an area where, you come into it, but you feel like an outsider. When you come into this community, you're welcome.
For Chicago Tonight, I'm Nick Blumberg.
The master plan still has to clear other key committees and the full city council. The development team hopes to complete the $600 million phase 1 by 2026. Still to come on Chicago Tonight, congressmen talk about the plethora of bills impacting voting rights that are popping up around the country, plus Capitol Hill security. The latest on how Chicago and the region are doing with equitable access to COVID-19 vaccines and how the new surge could threaten that progress. A new company will handle Chicago's Blue Cart recycling program. What new changes will it bring to the city's recycling efforts? And how a local bakery imports their unique blend of cultures to Chicago by intertwining Mexican flavors with traditional Jewish pastries. But first, some more of today's top stories. Neighbors around Melrose Park will again have access to Westlake Hospital now that the governor has signed legislation allowing it to reopen. The West Suburban Hospital closed in early 2019 and was planned for use as a temporary hospital to treat COVID-19 patients in the early days of the pandemic a year ago. The legislation allowing it to reopen fully will expedite the process of certifying a healthcare provider who must commit to at least $20 million to reestablish Westlake, adopt a charity care policy, and agree to own the hospital for no less than 5 years after reopening. United Airlines is taking off with a plan to increase the number of women and people of color in the cockpit. The Chicago-based airline says it will train 5,000 pilots this decade, including taking on pilots with no flying experience. Of that number, the company says half will be women or people of color. United is borrowing an approach used by other airlines to train newcomers at the company's own academy, in addition to recruiting from the usual sources like the military. Whether or not there is a shortage of pilots is up for debate as travel has receded during the pandemic. But a shortage is expected to grow in the coming years as a large number of pilots reach the required retirement age. And now back to Paris with some more from local members of Congress. Paris.
Thanks, Brandis. Earlier in the program, we discussed the massive infrastructure proposal, and we're now joined again by Representatives Mike Quigley, Raja Krishnamurthy, and Rodney Davis. Congressman, thanks again for being here. Another tragic event on Friday at the U.S. Capitol, an attack that resulted in the death of another Capitol police officer. What does this do to the security situation, Congressman Quigley, at the Capitol? Will there have to be a permanent barrier?
Well, I think there needs to be a barrier. I think it can be mobile depending on the need, but I think we have to reassess that. Look, I was in the room where it happened on January 6th, and sitting in that room that day, I think we all knew at least some of what we needed. A fast response team, better coordination, communication, clearly better intelligence, and a larger, better equipped, frankly, better trained police force. But for now, our thoughts are with the family of yet another officer we've lost.
And Congressman Davis, these are unfortunate events, unfortunate images out of the state capitol with all this security. Where is the balance going to be between security and public accessibility to these public buildings?
Well, I think General Honore and his team put together a very good report. Many of the recommendations were recommendations that I personally talked to him and his team about. My position as the ranking member on House Administration, we have oversight responsibility of the Capitol Police. And I had a conversation today with the Inspector General of the Capitol Police. He has offered some suggestions. He's offered some reports. We have to make sure that what we saw on January 6th never happens again, and what we saw Friday never happens again. Frankly, I think the fencing has somewhat exposed our National Guardsmen and women, and also our Capitol Police officers, because most of the time without that fencing up at the barriers where we saw the tragedy happen on Friday, those officers are standing behind the barriers that stop the vehicle from entering into the Capitol complex. They work, those barriers worked. So we've got to have a discussion, a bipartisan discussion on how to make our police force operate in a better, more efficient way, make sure there's training, as Mike said, but also we have to have better intelligence analysts, and we have to make sure that intelligence that comes through to the Cap Police gets acted upon. Those are the things I'm going to be pushing. And let's not forget, I mean, I'm here on this earth because the brave Capitol Police officers ran toward gunfire as I and my friends ran away from it on a baseball field.
And part of getting to the bottom of what happened on January 6th, even though there is a massive FBI investigation, is a commission put together by Congress. But that's been on hold for a while. Congressman Krishnamurthy, is the idea of a January 6th commission dead at this point?
No, I don't think so. I think that it's still subject to negotiations. But I'd like to add one other thing that we didn't mention, which is that the Capitol Police are vastly understaffed right now. Even by conservative estimates, they have about 232 open positions. Lieutenant General Honore recommended that we add at least 900 Capitol Police officers. Whichever estimate you buy into, they need hundreds of additional officers. Right now, they are overworked. They're utilizing tremendous amounts of overtime. They're just not in the fighting shape that we need them to be should another insurrection or a threat develop. And so we have to appropriate money to them right away to hire the additional police officers and personnel, and of course address that intelligence deficiency that Congressman Davis raised a moment ago. Because if we don't, we're just inviting more threats to develop.
All right, well, while this is happening, there's a national debate right now over voter restriction laws as corporate America, including Major League Baseball, is reacting to the new law in Georgia. Take a look.
This is much bigger than Georgia. According to the Brennan Center, as of March 24th, 361 bills with restrictive provisions have been introduced in 47 states.
Is this the biggest power grab since I've been in Congress? It will take away every state's ability to run free and fair elections.
Congressman Davis, a lot of Republicans upset over Major League Baseball's decision to relocate the All-Star game. Other corporate leaders coming out against Georgia's election law, like Coca-Cola, United Airlines, Delta Airlines. Your reaction to some of the pushback that we're seeing?
You know, it's frustrating. I certainly wish some of those corporate CEOs would have read the bill. They would have seen that many of the issues that Georgia voters faced were in areas run by Democrats where they closed polling places, they closed precincts. It caused lines, it caused delays. And there are provisions in place in the bill that's in question that actually expands opportunities for Georgians to vote. But it gets back to what we've been arguing at the federal level, that our states and our localities are constitutionally responsible for running our elections. Now, my colleagues on the Democratic side of the aisle have voted for twice H.R. 1. That's now going to be billed as a voting rights bill when it's the furthest thing from a voting rights bill. It's a bill that would put upwards of $7.2 million into every member of Congress's own campaign.
You're talking about public financing of campaigns and elections?
I'm talking about the provisions in H.R. 1 that passed on a partisan roll call, and the only thing bipartisan about it was the Democrat who voted with every Republican against it. It's a travesty. And those are the types of issues that Democrats are focusing on in Washington, just like they're putting forth so many proposals and plans in a supposed infrastructure bill that have absolutely nothing to do with infrastructure. It's always hide what the true intention is. And the true intention of the voting rights bill at the federal level, H.R. 1, is to pad their own campaign coffers.
Congressman, quickly, I want to get you to respond to that allegation that it's just about padding your own campaign coffers.
Look, I think the premise of these laws that are being introduced across the country is based on a lie, that there was some sort of massive fraud throughout the country. There wasn't. It was the big lie that was pushed by President Trump that helped create that insurrection. And they're using it to justify an action which absolutely isn't, its intention is to suppress. They didn't like the results, so they want to change the rules. You're talking about public finance of campaigns. That's a long discussed debate. Love to have that discussion at any point in time, but anytime we want to get rid of the dark money, anytime we want to put all of this on an equal footing where candidates go in there, I think that's far more democratic.
All right, a lot of things to get to. Unfortunately, I have to leave it there. Our thanks to Representative Mike Quigley, Raja Krishnamurthy, and Rodney Davis. Thanks as always. And now, Brandis, we go back to you.
In Paris, as we heard earlier in the show, Vice President Kamala Harris was in Chicago today to discuss vaccine equity with Mayor Lightfoot and other public officials. In recent months, the number of Black and brown Chicagoans who have gotten the vaccine has expanded significantly, in part through the city's priority zip code program. But hurdles remain in getting shots to every community, especially as COVID-19 cases are once again on the rise in Illinois. Joining us now is Mercedes Carnathan, an epidemiologist and vice chair of preventive medicine at Northwestern's Feinberg School of Medicine. Mercedes, welcome back. So we've seen this surge in COVID cases in recent weeks. How much of a threat does this pose to the vaccination efforts in Illinois and across the country?
You know, what this does is it really emphasizes the urgency of the vaccination efforts. We are facing rising cases after a few months worth of declines, and that is due in part to people circulating more. More things are open and places in which people will congregate. We need to stay on top of these cases by keeping up the pace of vaccination.
Now, as we mentioned, Vice President Kamala Harris was in Chicago today to discuss vaccine equity. Have the city and the state done enough to make sure that there is a level playing field there?
You know, I really think that the zip code program was solidly based in science. There have been recent reports to suggest that vaccination by zip code, where we see clusters of cases and clusters of cases as well as the most severe outcomes, is a good strategy to reach those who are going to be the most affected. And in this city where we have certain racial and ethnic groups clustering within those zip codes, this also does a dual job of promoting racial equity in vaccination.
Now, you know, for a long time early on in the vaccine rollout, we heard and spoke a lot about vaccine hesitancy, especially in the Black and brown communities. But we're hearing some information that those attitudes are shifting. What do we know about who is hesitant to get the vaccine?
You know, we have seen extreme improvement in the numbers of Black and Latinx community members who are willing to be vaccinated. And part of this is this snowball effect, right? So somebody's grandmother was vaccinated and they were fine. Another young adult is vaccinated and they speak positively about the experience. So all of those are real benefits. But the barrier we still face is how an individual secures a vaccine appointment. I think we still face inequities in the ability to snatch up this very scarce resource of getting that vaccine appointment. And when we rely on telephone and internet-based scheduling, that actually rules out an entire population who's not comfortable with those methods.
And you just talked about this a little bit ago, that Chicago earlier this year launched the Priority Zip Code program to address that disparity in who's getting the vaccine. And you say that it's based in science. Tell us a little bit about the impact of that program.
Yeah, so what's happening is the zip codes where we see a concentration of cases, those zip codes, individuals who live in those zip codes are eligible for the scarce number of slots for vaccination, because we certainly are still seeing that demand for vaccination is outstripping supply. So if we're able to reach people in those neighborhoods and specifically invite them, we have an opportunity to reach out to communities who are hardest hit. And the science suggests that this is a very good way when we get to these community-based vaccinations to try to stop the harm that's being done to those communities that are hardest hit.
So President Biden also today, he has moved up the deadline for all Americans to be eligible. Here's what Mayor Lori Lightfoot said about that today.
The president has now moved up his timeline from May 1st to April 19 for all adults in the U.S. to be able to have access to the vaccine. We will meet that deadline. We need more vaccine from the federal government, but we're optimistic based upon conversations that opportunity will happen.
The mayor saying we need more vaccine and millions of people will soon be viable or vying for a vaccine. Mercedes, what hurdles remain in making sure that vaccine access remains equitable when everybody is able to get it?
I touched on one before, which is that appointments need to be made to secure the vaccine. However, the introduction of the one-dose Johnson & Johnson vaccine, which doesn't have storage requirements that are quite as stringent as the original two-dose vaccines from Moderna and Pfizer, means that we won't have to defrost a certain number of vaccines and prepare them and ensure that we have an arm to stick them into before we start out. What it means is that with this one-dose J&J, which is more stable, we can bring it to people in communities and be able to reach out. And those are ways in which we can get to some of those hardest hit communities.
Now, several weeks after Illinois and Chicago reopened bars, other public spaces earlier this year, cases began to rise again. Are we reopening too soon and expanding that reopening too much?
It's a real challenge, and I am very sympathetic to the economic strains that the mitigation measures have caused for many communities. And it appears that we are balancing the risk and reward. If we keep businesses closed, individuals lose their livelihood. But when we reopen those businesses, it serves as an endorsement that it is safe for people to congregate together, and that is not the case. What we're seeing is a rise in rates in young adult populations, and these young adult populations are only now eligible for vaccination. So what we saw happen is what we could have predicted, and it's a very hard thing to see because as a result, our case rates are going up, and the lagging indicators such as hospitalizations and deaths are likely to follow. But we have these balancing economic as well as public health concerns. And right now, I think we're walking a really tough balance.
Okay. I'm sure it'll remain tough for some time to come. Our thanks to Mercedes Carnathon for joining us as always.
Thank you very much.
Chicago has yet to turn the corner on recycling, with its annual rate of trash diverted from landfills coming out to be less than 10%. But a contract shakeup with a local company could mean change is on the horizon. WTTW News reporter Patty Wetley joins us now with more. Patty, the city's Department of Streets and Sanitation announces it has ended the deal with Waste Management and is now working with a new recycling company. Who is this new company and why is this move significant?
Well, this is the first time in a decade that the Department of Streets and San has opened up the contract to put it out for bid. So Lakeshore Recycling, which actually has been collecting recycling from one of the city's zones through a subcontract, they've got 4 of the zones now. So Waste Management, which had been collecting recycling, is now out of the picture. And it's solely the Department of Streets and Sand and Lakeshore Recycling that are going to be managing the city's recycling program for the next 3 years.
Now, recycling advocates, though, they're only cautiously optimistic. Why is that?
Well, obviously, it's been a tough road. As you noted, we've been mired in the city, less than 10% recycling. There's a lot of skepticism amongst residents whether the city can manage this program. And some of that had to do with a lot of practices where recycling was being labeled as contaminated and it was being sent to landfill. So, you know, they're hopeful that this switch to lakeshore recycling will, you know, bring about a difference. There's some different language in the contract, and we're just hoping that we can get that recycling rate up over 10%.
Okay, I'm sure residents are eager to see how this goes as well. Patty Wetley, thanks for joining us.
Thanks, Brandis.
And you can read Patty's full story on our website. It's all at WTTW.com/news. Up next, a bakery that mixes Mexican flavors with Jewish tradition. But first, a look at the weather.
As a global destination for culinary adventure, Mexico City is full of exciting and surprising flavors. Among them is the unique food culture created by its robust community of Mexican Jews, which brings together some of the best food traditions of each community. Now, 2 Mexico City natives have brought their version of those flavors to Chicago. Producer Erica Gunderson has the story.
These are flavors that we grew up with. So we're just thinking about desserts that our grandmothers made or mothers made.
Flourless chocolate cake is a familiar dessert for many Jewish Chicagoans during Passover, when only unleavened bread is allowed on the table. But the flavors of Masa Madre's chocolate cake might not be quite so familiar. The glossy ganache topping their cake features the spices of Mexican café de olla, a twist that comes from the baker's unique blend of cultures. It's a twist they add to the other traditional Jewish pastries they offer as well.
I come from a community in Mexico which is Sephardic, so it's Middle Eastern, so, you know, pistachios, cardamom, all of those flavors. But we also have, you know, the tres leches. Those are flavors that are very Mexican that are also from our community. Challah is a bread that is braided. It's a bread that's typically made on Fridays for Shabbat, for Jewish day of rest. Babka is dough that is enriched. It has a lot of egg and egg yolks and oil, and we fill it with different fillings that we actually infuse with our Mexican flavors.
The bakers behind the babka are Elena Vasquez Felgueres and Tamar Fasha Unikel. They met a decade ago in their native Mexico City while studying fashion design. Vasquez Felgueres moved to Chicago in 2016 so her wife could study at the School of the Art Institute. Fasha Unikel arrived 2 years later so her husband could complete his master's at the University of Chicago. The reunion gave rise to a fledgling business.
One day we were having dinner at her house and we were thinking how Chicago needed more bread, more fresh bread.
The pair began selling homemade sourdough loaves at farmers markets, but soon switched to confections combining Mexican and Jewish traditions.
There's about 40,000 Jews in Mexico City, so it's quite a large community and it's very tight. So this mix of flavors, I feel like it's happening a lot in Mexico, Mexico City especially.
I think a lot of people don't know that this is like a mix of culture that exists, so they're surprised.
Before long, demand had outgrown what their home ovens could produce.
So we were baking out of our very, very small kitchens at home, and it was taking a lot of time to make.
As the holler for their challah grew, so did Masa Madre. Last October, they moved their baking to the Hatchery, a food incubator on Chicago's west side.
Each year it gets more busy, which is very good.
Since their sales were already conducted entirely online, the pandemic hasn't slowed them down.
After everyone like shifted towards being online, people started getting more used to the idea of pre-ordering and picking up and all of that. So it was easy for us to transition and to just flow with it.
And they say that sharing the flavors of home with Chicago has made Chicago feel more like home for them, too.
I think it was hard to find something that could connect us to the people here. And after we started making bread and like sharing it with everyone, we've met so many people through this business. Other women, other people just trying to make small businesses and share their stories.
Having this business has really like opened a space for us here in Chicago and made a community around us.
For Chicago Tonight, this is Erica Gunderson.
Shouldn't have watched that on an empty stomach. That flourless chocolate cake is off the menu until next Passover, but Masa Madre offers their babka and challah year-round, as well as other seasonal treats. You can find more information on our website. And that is our show for this Tuesday night.
Please join us tomorrow night live at 7.
Now for all of us here at Chicago Tonight, I'm Paris Schutz.
And I'm Brandis Friedman. Thanks for watching. Stay healthy and safe, and have a good night.
Closed captioning is made possible by Robert A. Clifford and Clifford Law Offices, a Chicago personal injury and wrongful death firm that is proud of its partners named Illinois Leading Lawyers by the Law Bulletin Publishing Company of Chicago.